In adolescent baseball players, elbow injuries are primarily associated with valgus and external rotation stress during pitching motions. As this stress repeatedly applies excessive force on the elbow joint, tension occurs in the ulnar collateral ligament structure on the inner side during the process of straightening the elbow joint. Over time, this tension can lead to ligament injuries and damage to the joint cartilage, known as ulnar collateral ligament injury and osteochondritis dissecans, respectively. To prevent elbow injuries in adolescent baseball players, it is important to maintain good pitching mechanics and make sure the player is not subject to excessive force during the pitching motion. Additionally, it is important to have a good understanding of the anatomy of the elbow and to treat any injuries early in order to minimize the potential for long-term damage.